Carol and I'm a student at Ohio State. And through my studies, I've discovered that the healthcare system in the United States has worse outcomes and limited access to care to comparative countries. Today I will be sharing with you some health aspects of not only the United States but also another comparative country, Taiwan. So Taiwan's healthcare system is a national health insurance system that requires citizens and all residing foreigners to enroll into the healthcare system. So this means about 99.9% of Taiwan's population is enrolled and has access to healthcare. The national healthcare insurance that Taiwan provides, they also provide an IC card, which is a card that identifies every person that is enrolled, and it allows the primary care physician or whoever they go to see access their information. So the card contains personal information, insurance data, 6 most recent medical visits, diagnoses, drug prescriptions, drug allergies, major illnesses, and many more information about the patient. So this is something I would really consider the United States adopting within their health insurance. Private health insurance in Taiwan is typically cash only and pays for the services the NHI does not. So for example, it would be a private hospital stay or private hospital rooms or products such as the drug-eluting stents. The United States healthcare system is a cluster of public and private insurances that many people are unable to pay for. So the United States health insurance is publicly financed through Medicare and Medicaid, drug purchase, or TRICARE, which is only meant for military personnel, and it only covers about 4.8% of the population. The private health insurance in the United States is only through private voluntary health insurance or its employer provided. In 2017, the life expectancy in Taiwan for the total population was 80.2 years old, and for men it was 77.1 years old, and for women it was 83.6 years old. In the United States, the total population was at 78.6 years old, for men at 76.1 years old, and women at 81.1 years old. So as you can see, the life expectancy is only differed between 1 or 2 years, and even though it's only 1 or 2 years, Taiwan does have a better life expectancy than of the United States. So in 2016, the United States healthcare spending was found at a big, huge $10,348, where compared to Taiwan's healthcare spending was only $1,430, and there is a huge significance there. And if we refer back to the life expectancy, although Taiwan is only a year or so greater than the United States, Taiwan spent drastically less healthcare spending than the United States. So in 2015, the United States reported that 42.6% of the population visited the emergency department, whereas Taiwan recorded only 33.5% of Taiwan's population visiting and utilizing the emergency department. We've so far learned that Taiwan had better health outcomes with life expectancy and lower spending on healthcare, and thus with this 10% less of about 10% less of visits in the United States for the emergency department, I would highly suggest changing the sick culture and where people utilize the emergency department because they don't see a primary care physician, or they don't practice preventative care, or really have relative access to care. So I think by changing the sick culture and allowing new policies and programs to be implemented, allowing the United States and Taiwan citizens and individuals living there to be able to access primary care physicians annually at least, and by being educated on preventative care, this would change the culture and potentially decrease the visits to the emergency department and an increase in the life expectancy in maybe both Taiwan and the United States. So in 2015, it was found that Taiwan's prevalence percentage was at 17.1%, compared to the United States, where it was at 15.1%. So with that being said, in 2016, both countries implemented new tobacco reducing demands, and so Taiwan focused on reducing tobacco demand, and that really focused on giving a smoke-free environment, pictorial health warnings on packaging. They banned the advertising of tobacco, and they even started trying to provide smoking cessation services. And lastly, they really tried reducing tobacco supply. Whereas the United States, they started the State of Tobacco Control in 2016, and this basically focused on controlling tobacco and prevention of spreading. They tried to do a smoke-free air environment and put higher taxes on tobacco, and even tried to do cessation coverage through insurances. So after seeing the really high prevalence in both countries, I looked into secondhand smoke exposure, primarily in children 3 to 11 years old. And it was found that 28% of children in Taiwan are exposed to secondhand smoke, and 37.9% of children in the United States are exposed to secondhand smoke. So although Taiwan had a higher prevalence in their smoking and tobacco use, we see a higher percentage of exposure to secondhand smoke in the United States. So possibly in order to reduce these numbers, there needs to be a clean indoor air policy to protect children from being exposed to these secondhand smoke environments, especially this picture of this child and their parents smoking in a closed car where air filtration isn't the best. So I think that's something that needs to be changed. So access to care, there wasn't much information for Taiwan, sadly, with primary and specialty care physicians, but in 2016 there was an overall of 190 per 100,000 of the population that were physicians, and in the United States the overall was 271.6 per 100,000, whereas primary care it was 91.7 per 100,000. And then there was unfortunately no specialty care data for the United States. So with the low level of primary care physicians, I believe in the United States could be correlated to the high percentages of emergency department visits, because if you are not accessing primary care physicians, or you're unable to access primary care physicians, you're going to again go back into the sick culture, wait till you're sick and access the emergency department to get better help. So then I looked into the teen birth rates of 15 to 19-year-olds, and it was found that in Taiwan, 4.02 per 1,000 were the rate of teen births, and in the United States it was at 26.09 per 1,000. So there's a huge gap between Taiwan and the United States in their teen birth rates, and I think it would be great for the United States to perhaps implement a teen pregnancy prevention program, more safe sex education programs implemented to their school life, and maybe giving teen mom talks of experience, and it's not this glamorous thing, and what can be done to prevent it. So that are just some suggestions in reducing the alarmingly high rate of teen birth rates in the United States. So, in conclusion, we kind of found that Taiwan does have better access to healthcare due to the country's national health insurance, and its requirement for all citizens and all residing foreigners to enroll into the national health insurance, because that means 99.9% of all the individuals in the country are enrolled and have access to healthcare. So another thing is that in the United States, we see that 5.4% of children under the age 19 years old are uninsured. That's just a little comparative of the United States and Taiwan, where everybody's insured and has access to care, where people underage are 5.4, which is still significant, have are uninsured and probably do not have access to care. We also, throughout, we found that, Taiwan does have a higher prevalence in smoking, but like the children in the United States experience more secondhand exposure than, in Taiwan. And when compared to the United States, Taiwan had better health outcomes, of better life expectancy by a few years, had lower spending on healthcare, and it definitely had less emergency department visits and lower teen birth rates significantly. So I just want to leave you here with us today. And with the advancement in the healthcare field, now is the time for the United States to take a step back and perhaps learn from other countries, to research and look into how we can better the healthcare system for our people and build a better and more well-rounded healthcare system. Thank you.